What up everybody, it's your boy Kai, and I'm back with another update video. So let's get into it. For those who don't know, I went to San Francisco on Sunday, and I got back on Wednesday. It was a freaking blast. San Francisco is beautiful. I love the area, the atmosphere. For those who aren't familiar, there's a street called Castro Street, and it's so queer, so affirming, and it's just so many diverse people that I actually got to see. People being themselves, being authentically who they are, and all of their queerness essentially. And it was so amazing. It was so dope. Definitely not something I find in Youngstown like ever. San Francisco had my heart completely. If I wasn't so dead set on moving to Brooklyn sometime in my life, I would definitely put San Francisco on my list of places to live. My trip was actually really big for me because I never flew on a plane by myself before. I have a really big fear of planes and of heights in general, but definitely planes because there's so much that could go wrong. I know that's horrible to think about, but it's something that I constantly thought about on the plane, and it's definitely something that's kept me from traveling as much as I'd like to. Me going by myself across the country was definitely a big deal for me. I had to take 2 planes to get to San Francisco, and I had to take 2 planes to get back to Ohio, and that was a wild time for me. But I made it, and that's what's important. The reason I went to San Francisco in the first place is because I had to have 2 in-person consultations with my surgeons for bottom surgery. One surgeon's name is Dr. Chen, and the second surgeon's name is Dr. Safa. Now, there's probably going to be other people working on me too. Actually, I'm certain there will be, but they are the 2 main surgeons I actually had to talk to and have my consultations with for this upcoming surgery. Day 1. I got on the plane in Cleveland about 5:50 something in the morning, and then we ended up landing in Chicago. From Chicago, we went to San Francisco, and all was well. After we landed, I took a lift to where I needed to go in San Francisco, which was only about a 25-minute ride from the actual airport. Went to my Airbnb, which was close to the Castro. My host was amazing. I did not expect him to be so amazing, but he was. He's a white gay guy named Michael, and he's super knowledgeable and respectful of trans identities, so it made my stay even better. We talked about my upcoming surgery and why I'm in San Francisco. And he was just super proud of me, super happy, and he definitely wants to stay in touch with me after I get my surgery, especially since I'll be in the San Francisco area. Maybe I'll be able to see him. After I got acquainted with him, I charged up my phone and took me a little nap for a few hours because I was just so jet lagged. After I took my nap, I was hungry as the devil, and Michael had just told me about this place called Hate Street, which essentially is more like an area than a place, but you get what I'm saying. I was like, all right, I'm gonna GPS this place. I'm gonna figure out what's around there so I can get food. And lo and behold, I ended up GPSing a thrift store. And since I was looking for overalls while I was in California, I'm like, this is perfect. I'll go to the thrift store first, and then before I come back home, since it's getting a little late, I'll go to get some food. I went to a thrift store called the Buffalo Exchange, I believe, and they had a pair of overalls. They didn't fit though, so I was a little sad. But I got this really cool Godzilla t-shirt that is just, I'm like, this is fucking amazing. We're gonna get this. I ended up going to this place called Mama G's, I think it's called, which was not worth the money at all to me. It was really expensive, and the food just wasn't, it just wasn't good enough for what I paid, in my opinion. Completely my opinion. Day 2. I had a consultation with Dr. Chen around 2:30 p.m. Luckily, the campus we met at is only about an 8-minute Lyft ride from where I was staying in my Airbnb, so that was just perfect for me. He's super cool. He's good looking, which is always nice because who doesn't want a surgeon that's kind of good to look at? He's super knowledgeable about everything about the surgery, which you would expect, but some surgeons really don't sound like they know what the hell they're doing. So to hear him just talk so easily about what we're anticipating, what could be happening, this, that, and the third, it was just really comforting. He confirmed what I had already figured going into California in the first place, that I am not a good candidate for alt phalloplasty. Alt is essentially using your thigh as a donor site. I had already been mentally preparing for that to be said to me anyway, so when he told me, I was a little less sad than I would have been. He told me that we could do my thigh still, but there's a lot of complication, or we could do my thigh as the phallus and use my forearm, this area right here, as the urethra. However, the risk of complications for that's even higher. Of it failing altogether and me losing either the urethra or the phallus itself was so high, I think like there's a 70 or 80 chance that something major is going to go wrong, and those numbers just don't sit right for me. What we ended up deciding on is just using my arm, which is what I was completely against. I think I talked about this in other videos. I was so against using my arm, but realistically speaking, the risk of complication is so much lower and the amount of surgeries I'm gonna have is just so much less. What we're gonna do is have a single stage. So I'm gonna have the phalloplasty, the vaginectomy, the scrotoplasty, the urethral lengthening, my nerve hookups and all of that, and glandsplasty all in one surgery. Knock on wood that everything goes well. The only other surgery I'll have to have is for my testicular implants, and that's gonna come between 9 months to a year after my surgery. I do want an erectile device implant, but I don't want any of the technology that we currently have in the US being put into my body. Currently, what's in the works in the medical field is they're trying to bring stuff, I think from Europe or something, over to the US and actually perfect it here. So by the time I actually want to get an erectile device implant, hopefully the technology is just A1. For now, I'll just use the elator, which I describe as an extended cock ring. Don't know how to better explain it to you, but if you want to, you can look it up on Google because Google has everything. We decided on my arm. That was a hard pill for me to swallow, but I think I'm doing a pretty good job with it. He also said that what I want aesthetically for my phallus is achievable with the arm that I have, because I have a good thickness, a good amount of fat in my arm, and I also have long forearms, so the length and the girth shouldn't be an issue for me. Dr. Chen also suggested that I become vegetarian to help with my hypertrophic scarring, because I am prone to getting hypertrophic scarring. I don't remember if I did a video showing my top surgery scars or if I actually just didn't upload the video I had made showing my hypertrophic scars, but I'll make sure I do that sometime soon. Me continuing to exercise like I have been is helpful, and also being vegetarian might help too. And regardless, it's just something I wanted to do anyway, but him kind of telling me that just confirmed that I'm just gonna be vegetarian. I'm gonna do this journey, make it my lifestyle, and one day, hopefully, become vegan. My partner is actually vegan, so this isn't very difficult for me to transition into. After my consultation, I ended up walking to Castro Street and just exploring around a little bit. From Castro, I went to Valencia. I was looking for a thrift store because, again, I wanted to find overalls. Like, I came to San Francisco with overalls on my mind. So I went to Valencia, explored around there. Where I'm at in Ohio, we don't really walk like that, we drive. So me being in San Francisco, I wanted to definitely utilize my legs and get some exercise and also be able to really explore the town without having to just see it from a car. And also I was saving money. Didn't find any overalls, but I did find some really cool shops and just places to take pictures of and all this artwork and everything. I went to a thrift store on Valencia. It's the Buffalo Exchange. It's like their second store or whatever. And I got this really cool Leatherman jacket that's based on the Breakfast Club, and it's definitely one of my favorite purchases of the entire trip. I ended up taking a lift to Market Street, and I ended up going to the Westfield San Francisco Center, which is essentially a really big mall. Still looking for overalls, didn't find any overalls, but someone suggested I go to Urban Outfitters and that they'll definitely have overalls. Before I went to Urban Outfitters, I ended up picking me up some food at the mall. I forget what the place is called, but their pasta was A1. Hit up Urban Outfitters, ended up finding me 2 pairs of overalls, and I was like, I gotta get these. I found 3 pairs, but I only had money for 2, so I was like, you know what, we're gonna get it, fuck it. We're on this nice little vacation in San Francisco. Not really a vacation, but I'm looking at it like a vacation because I took off work. So I'm gonna have fun and get something. My 2 overalls, happy as a tick, ended up going home. Day 3, I had my consultation with Dr. Safa in the Bunkie Clinic. He is a really nice guy too. So luckily both my surgeons are super nice. They're not condescending. They don't make you feel stupid for not knowing anything or asking a lot of questions. And I had so many questions for both of my surgeons, and they both made me feel super comfortable asking every single one of them. And they answered every single one of them for me too. He also confirmed what Dr. Chen had told me about my arm, so the length and the girth. We discussed the pros and cons of everything again. Dr. Chen is a urologist and Dr. Safa is the microsurgeon. So it was nice hearing both perspectives and hearing the pros and cons from a different outlook. Told me to remind him that 1, I'm prone to hypertrophic scarring. So what we might do is make my urethra a little wider than they normally do. That way it allow for some scarring in case that were to happen, and hopefully we can avoid it getting a stricture or having to really fix anything from a stricture. 2, wants me to remind him to use the left side, my non-dominant arm and my left thigh. My phallus, essentially what we're going for is 6 inches, so he told me to get 7 inches of laser hair removal. I have my handy dandy measuring tape. That way I can kind of give you an idea. The wrist crease, so from like right here essentially to about right here where my jacket stops. This is how much I have to have laser hair removal all around my arm. Also showed me a picture of a patient that he had fairly recently whose skin tone was very similar to mine, which I have not really seen a lot of. So this was super comforting to see. Phallus looked nice. I was actually impressed. He had also had his forearm done. Dr. Safa told me essentially how my girth and my length would differ, be a little bit bigger than his. It looked perfect to me. If that was on my body, I would definitely be super duper happy. So like I said, we decided on 6 inches for the actual phallus. Anything bigger than 6 inches would pose a lot more risks for blood flow and just for your phallus in general. Also, it'd be a really huge annoyance in your pants, because unlike people with natal penises, trans men and non-binary folks who end up getting neophalluses, which is essentially phalluses created, we're not going to be flaccid and then get erect. So what size we are is essentially what size we will be, and it's going to be in our pants like that. So 6 inches definitely works for me. It allows for some room in shrinkage, because sometimes after you heal up or right after surgery, your skin shrinks a little bit. But then because of gravity and how your phallus is, on your body, it could also end up stretching a little bit longer than 6 inches. So 6 inches is definitely good for me either way it goes. He said my girth, which is something I was worried about, being too skinny, he said I shouldn't have that problem because my girth should end up being between 5 and 6 inches circumference. Let's take it back to the measuring tape, all right? Essentially, 5.5 inches circumference would be roughly like this. This is a little difficult, like this. This girth, that's enough. So I said I was happy with that. I could definitely live with that. It's super fine for me. It's essentially what I had imagined anyway. I do need hand therapy, and because I have arthritis in both of my hands, I'm figuring I'm gonna need hand therapy a little bit longer than most people who have to get it. It's offered in the hospital where I'll be staying for approximately the first 5 days. I'm not sure when I actually start the hand therapy, but I'll definitely be going back to the Bunkie clinic. Maybe not the clinic, but wherever I'm going, wherever they have me going, maybe UPMC Davies, really. That's the hospital. Wherever I'm at, they have hand therapy offered. I'm definitely gonna take that seriously because I would like to get as much of my range of motion back in my arm that I can, especially because of my arthritis and how that already affects my hand. Dr. Safa said that he's gonna give me what they call a protocol, which is essentially just a list of things to do with my hand, to give to whatever hand therapist I go to after I leave San Francisco. My plan is, after I leave San Francisco, I'm going to Brooklyn for at least 1 month, hopefully 2 months. That way I can heal up out there. I have lots of friends, lots of family out there who I know can help take care of me. Then I'm coming back to Ohio sometime in September. Right now I'd like to come back between the 2nd and the 3rd week of September, so that's the current plan. Essentially, what's on the agenda now is preparing myself for the actual surgery financially, because right now I'm very stressed, very overwhelmed. I'm going to continue saving and raising money for the surgery. That way it can help me with medical expenses, to living and traveling. I also have to prepare myself mentally and emotionally and spiritually. My arm is not going to look like this or this after June, and that's something that actually scares me a bit. But I think with the support system I have, they're doing a great job of keeping me motivated and keeping my head up about everything, and they're reassuring me that everything is going to be fine and my arm is going to be fine no matter how it looks. I'm gonna get serious about cinematography, videography, screenwriting, producing, animation, and filmmaking as a whole. Shout out to my partner for being super amazing and helping me find my passion. Now I just have to continue learning, continue teaching myself, continue learning from them, continue just picking up bits and pieces wherever I go and whatever I see. That way I can become very good at what I'm passionate about and get very good at this craft. Especially with all the traveling I'm going to be doing, there's no reason for me not to be getting inspired and taking everything that I see and learn and pick up and producing amazing content, and that I can put right here on this channel. Lastly, I want to try to be not as stressed or overwhelmed as I am right now in this moment before or after surgery. For health purposes and for healing purposes, I can't. Like, I physically and emotionally cannot be as stressed and worried and overwhelmed as I am right now. So that's definitely something I'm going to actively continue working on. I'll be updating you all again soon. But if you have any questions for the time being, please feel free to hit me up on any of my social media networks, and I'll respond to you in a timely manner. Give me, at least a couple hours, because with work and school and how busy I am on a regular, sometimes it is hard for me to just respond right away. Stay tuned for more videos. Also, if you appreciate my videos, you learn a little something from me, and you enjoy following along with me on this journey to my bottom surgery, please consider clicking on the You Caring link that's in this description. Consider donating even $5 to $10. Much love to you all, and I'll be back with another video.